Hi, I'm Laura Mize, pediatric speech and language pathologist, and I'm here to bring you teachmetotalk.com's therapy tip of the week. If you're a pediatric therapist, chances are you use wooden puzzles as part of nearly every therapy session. Today, let's talk about how to maximize the effectiveness of using puzzles, how to target lots of different goals beyond just naming the puzzle piece, and more importantly, how to hold a toddler's attention and increase participation with an activity that can sometimes get a little boring. First of all, make sure that you're offering a wide variety of puzzles. I own an embarrassing number of wooden puzzles. In fact, when I start to clean out my toys every year, I purposefully make myself give some away and then I just buy more. So be sure that you carry more than just one or two in your bag and that you're not using the same puzzle week after week after week in sessions with toddlers, because that can get pretty boring. So let's talk about variety. You can find lots of puzzles with animals. I have one here with toys. And here's some different ones. This one has food, and this one is bath time. Lots of objects that you would find in a typical family's home in the bathroom. So by giving yourself more options, you're automatically expanding a child's vocabulary just by the introduction of your stimuli that you're using. I love this puzzle from Kids Express Train. I think I got it from childrenspublishing.com because it has a wide variety of vocabulary, but they're all really appropriate for early expressive language goals. So again, words like plane, tree, choo-choo, boat, duck, dog, star, apple, hat, ball, shoe. Again, really prominent, prevalent, high-frequency words that a toddler would use. So love a puzzle like this. So be sure that you're looking at what your targets are going to be when you are purchasing your puzzle so that you can make sure that it really makes sense for the kids that you're working with. Now, some of our friends are not ready for the puzzles that I've just shown you, the 6 and the 9-piece puzzles. What do you do then? Should you introduce a puzzle like that and almost ensure failure at that activity because there's no way that they can sit through 9 whole pieces of the puzzle? For that kind of kid, I might start with something that's more simple, like this. This is a foam puzzle, and I love it because it just has 3 pieces. There's a face, a mouth, and eyes. And because it's a little different than something that a toddler's probably played with before, and they have to use a little more effort to get the pieces in, they actually will stick with it longer than maybe some of your other wooden options. The other thing that I do with this puzzle is after we have the pieces in, I let the toddler use his little fist to punch the pieces out, and we practice exclamatory words like pow or wow or bang or boom as he hits out the pieces. And again, you will be amazed how many times a toddler will sit through putting the pieces in and even having you do a coordinating activity like show me your eyes, show me your mouth, because he knows at the end his reward is getting to punch the pieces out of that puzzle. So great way to use puzzles. The other thing you want to consider with children who are a little lower functioning, children who have more significant delays, you'll need to really compare the way that the puzzle is set up and what motor skills the child will need to complete the task. I love this puzzle by Melissa and Doug because it's so cute and it's so attractive visually, and I like the vocabulary too. House and tree and cloud and sun are words, and you might not find that on another puzzle. But look, there are no pegs. And I think using this puzzle, even though I'm not targeting quite the same number of vocabulary words here, it still might make it a little easier for a child to stay with me because it's easier for him to get the pieces in. So when you have a child not wanting to complete a therapy task, you have to think beyond the behavioral component. He just doesn't want to sit with me. It could be that from a motor perspective, this puzzle's just too hard for him to do. He really needs the pegs to help him guide the pieces in. So that's certainly a consideration that you'll want to factor in with a child. One thing that I do with puzzles is I always, again, if I'm finding that the child doesn't want to play with me or I'm having a hard time keeping him, I look for things that might make a regular activity a little more exciting. So with the puzzle, using one that has magnets so that you can catch the piece might make it a little bit more fun. But let's look at this puzzle a little closer. It's going to be harder for the kids to match because there's no picture to show the kid where the piece should actually go. And honestly, this one's hard for me to do upside down. So I had to put the numbers in there so that I could see which one matched. So you might want to do that. Another way to create excitement is to keep your pieces inside the bag. Maybe shake it up and then let the kid draw one out one by one. Now sometimes as adults we might want to put all of the pieces out and have the kid name it, but that's a little boring. So I like keeping them in the bag and having him pick like I just showed you, or maybe even 2 at a time. Now let's talk about this particular puzzle. A lot of parents and even some professionals might automatically try to work on numbers or colors with this kind of puzzle. If you've watched or read anything that I've ever produced or written, you'll know that I hate that with toddlers with language delays. We should not work on those academic concepts until a functional core vocabulary has been established. So with this kind of puzzle, I might just work on car. And the reason that this, you're probably thinking, Laura, there are 10 pieces and you're just going to get one word out of the entire task. Yeah, if our goal is an initial k, that's called mass practice. If I can get lots of k in car time after time after time, that's been a really productive and really efficient therapy goal. So that might be a different way for you to think about your materials there. That's this one. Another way that you need to think about puzzles too, and this is related to the last problem where we just had the numbers and the kid might have a harder time matching, is sometimes it's too visual, the background is too visually distracting. I love this farm animal puzzle, but look at it. There's a whole lot going on here. So for a child who has some sensory issues, maybe there's some visual impairments, or again, maybe he just has a harder time processing visual information. This is too busy, and he may want to leave this activity because it's too frustrating. He's not successful. So you might need to look at puzzles that have a really plain background, and again, the pictures are colored and they're an exact match. Now sometimes you'll buy these puzzles, and actually this happens more in your discount stores, where you're matching a color piece to a black and white picture, and that's super practice if a child is cognitively ready for that. But if not, that again may be a factor that he doesn't want to participate. So think about that carefully when you're planning your activities. Again, this is a 9-piece puzzle. That's going to be too challenging for some of our little friends because of their attention spans. So it may be okay for you that he just does 3 or 4 pieces. A better way to do that is to think about half the puzzle you're going to be working on one goal, and half the puzzle you'll be working on another goal. And let me give you a better example of this. This is a cool farm animal puzzle, and again, it's there's a lot going on here, and therapists and parents might only think about using the puzzle to name the noun or name the puzzle piece. But you can even use a puzzle like this to target expressive goals that might happen before a child is really ready to name the pieces. I think nothing is more frustrating for you to present to a toddler over and over and over, where you stick the piece in front of his face and say, "What's that? What's that? What's that?" when he's never, ever before said the word horse. And you're asking him to do it in a really confrontational way. So there are lots of things that you can work on expressively before you get to that point. I love a puzzle like this because it gives me more options. We can work on a child imitating, not the word, but an action. And imitating an action must come first. Imitating a motor movement will always precede verbal imitation. So with a puzzle like this, I'm going to knock, 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 and see if the child can just knock. Hopefully, I'm going to get that word too, knock, 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 knock. That's part of a verbal routine. After we do it 7 or 8 times, and I really model that for him, and it's really fun and exciting, he might start to say that word as he imitates the motor action too. Another thing that you can do with this kind of puzzle, especially if you're losing a kid, is to target receptive language. So let's say that we've opened the doors and we've identified several of these animals, and we have our pig and our horse and our bunny. I might say, make the horse go night-night. Let's put the horse in the barn. And so the child has to pick up the horse and put it in the barn. And again, you're still targeting your expressive goal as well, because you're going to close the doors and say bye-bye. Perhaps even, shh, if you're working on those exclamatory words and imitating at an earlier developmental level. So lots of different things that you can do. You may be able to target an even higher receptive language goal with finding 2 different animals. If you had 5 or 6 of your pieces, you might say get the bunny and the pig, get the cow and the duck. And again, working on this kind of goal is an easier step down from a 2-step direction, which lots of our friends have difficulty with. Another way to work on that might be saying, get the pig and give him a kiss. So again, you can mix your goals up, and by doing that, by introducing that variety, there's more of a chance that a kid will actually want to stay with you. Another way that you can target receptive language with puzzles is by doing object functions. I love to use puzzles like this, a transportation puzzle and a clothing puzzle. You could say, which one goes on your feet? Which one do you wear on your head? Which one flies? Which one says, woo, woo, woo? So you're targeting that receptive language skill, again, using a material that you already have. If you have brothers and sisters that you want to involve in therapy, this is a super way to include siblings. And you can also ask questions that might be a little more challenging to the older brother and sister and get them to stay with you and participate rather than being a total distraction. So that's another way to use these kinds of puzzles. What I like to do is use auditory processing games where I'm using the puzzle and putting it even on the other side of the room and giving those same kinds of directions. You could say, go get the shirt, or make it a little harder with go get the shirt and the jacket, or again, you might use your object functions there. So mix it up a little bit. You'll see on the summary at the bottom of the video, if you'll scroll down, there's some additional ideas for using puzzles for those auditory processing games. Another way, the last way that you can use a puzzle is by targeting some of your higher level intelligibility goals. I love this puzzle and use it when a child gets to the point that I'm trying to introduce multisyllabic words. So words like butterfly, grasshopper, ladybug. And a kid may not be there in terms of articulation, as in getting every consonant in the right place, but you've got to work on syllableness, or that phonological process, or even the motor sequencing part of getting multiple syllables in a row. And so a puzzle is a good way to do it. Again, because a child like that will be a little older and a little further along cognitively, I love that it's a magnet puzzle and there's a net and it attaches here. And again, it's a little harder for the kid because the picture's missing, so it's a little harder to match. And so that might keep a kid with you a little longer. I hope I've given you some new ideas and a way to kind of jazz up the way that you might use puzzles in your therapy sessions. Let me know if you liked it. Thanks so much. That's all for teachmetotalk.com's Therapy Tip of the Week.